Hello, my name is Dr. Rebecca Knibb. I'm a health psychologist working at Aston University in Birmingham. I've been conducting research in food allergy roughly for the last 20 odd years, and more recently been conducting work in asthma as well. I'm a member of the Adolescent and Young Adults Task Force, and I've been working with colleagues on this task force to develop a systematic review of interventions for adolescents and young adults with allergy and asthma. In this presentation, I'm just going to spend a few minutes telling you about our review. In this short presentation, I'm going to cover what the aims of the systematic review were, how we did the review, what the main findings were, and our conclusions and gaps that still exist in the research. So what were the aims of our review? Well, our review aimed to look at literature on interventions for improving self-management and well-being in adolescents and young adults with asthma and allergic conditions. And we were interested in looking at ages 11 to 25 years. Why were we doing this? Well, adolescents and young adults with asthma and allergies are a group that we know have quite poor engagement with their self-care and their health condition management. They quite often have poor adherence to medication, and they have quite a low perception of risk. However, adolescence presents a really great opportunity to educate them using interventions, because this age group are really keen to gain independence and start looking after their own health. What did we do? Well, we looked at studies on adolescents and young adults with allergic conditions, and these included asthma, food allergy, allergic rhinoconjunctivitis, atopic dermatitis, chronic urticaria and/or angioedema, and allergic gastrointestinal diseases and complex multisystem allergic diseases. We included study designs that were controlled trials of an intervention, so they needed to have 2 or more groups, or randomized controlled trials, so where the groups, the participants in the groups were randomized to either the intervention or a control group. We included quite a lot of study outcomes, and these were psychological, social and behavioural issues, adherence to medication, anything to do with skills needed for coping, self-care, deprivation, disease control, and symptoms. What were the main findings of our review? Well, we found 30 papers reporting data from 27 studies, and there were a number of different intervention types. These included psychological, e-health, educational, peer-led, and breathing. However, all the interventions were for asthma only. There were no interventions at all for any of the other allergic conditions. So I'll just spend a couple of minutes telling you the main findings from our systematic review of each of these interventions. For psychological interventions, these resulted in significant improvements in the intervention group compared to the control group for a number of outcomes. These included self-esteem, quality of life, self-efficacy, coping strategies, mood, and asthma symptoms. For e-health interventions, these were interventions that were mainly provided using a computer or mobile phone. These led to significant improvements for inhaler technique, adherence, and quality of life. General education interventions had significant improvements for quality of life as well, and for management of asthma symptoms, control of medication use, increased use of written management plans, and reduction of asthma symptoms. Peer-led interventions were interventions where peers with asthma led the interventions for usually a younger age group who also had asthma. And these included validated interventions such as the EAACI Adolescent Asthma Action Programme and a peer-led camp based on the Power Breathing Programme. Here again, improvements were found for self-efficacy, school absenteeism and quality of life. So what are our conclusions? What gaps still exist? Well, although there were significant improvements seen for all intervention types, many were small feasibility or pilot studies. There were no studies at all for allergic conditions other than asthma. So we still need research to investigate interventions for these other allergic conditions. We also need research using large longitudinal intervention designs across a range of allergic conditions, and these are really required in order for us to strengthen our research evidence base. So for further information, you can find our systematic review here by clicking on this DOI link. And if you have any other comments or questions, you can always email me on r.knibb@ac.uk. Thank you very much for listening to this presentation.